today, our focus is what makes a startup investable, right? Because that's how you're being judged during the competition. Again, how investable is the overall startup? It's not just the idea. So we'll go over the market opportunity, the TAM, SAM, SOM, and the go-to-market strategy, because those are closely tied together, and they will flow into the financials and everything else going forward. So again, what are we covering is we covered last time, we covered the unique value proposition. Today, we'll talk about the market size, and we'll go into team execution advisory boards. We'll start going into financials actually probably next time. And then if there's anything left to wrap up for the financials, we'll do it in module 4. We'll also touch upon valuation and then go through the pitch deck format. Again, by then, hopefully most of you would have connected with me and I would have been familiar with your pitch deck that you want to present. But this would be the time to discuss how you structure it, your particular deck. But we'll go over the generics. Again, what makes a startup investable and why we do it this way is, your unique value proposition is the most important. It's a product market fit. How big is the market? Can your team execute on what you're promising? And can it make money for investors? That's the financials, the valuations. And we covered this. So just a quick reminder, your product market fit and your value proposition, it's knowing about what your customer needs, what is their job to be done, and then either eliminating the pain in trying to get that job done or giving them gains as they execute what they need to do. Again, it's not about your product. They don't care about your product. They only care about the job that they have to do, and your product is simply a tool. And the more you get into the head of the customer as opposed to your head, the more you will be able to pitch it better to both your potential customers and investors. So let's talk about the market size. I'm assuming most of you have seen those TAM, SAM, SOM circles. This is probably one of those very controversial slides almost, because you will get so many opinions on how to do your market sizing. So you explained in your value proposition who your customer is, right? And the formula that we used was for the customer who is trying to do a specific job that you described. You created a tool to enable them to do that job better, and you explained how, be it saving time, money, optimizing it, allowing them to do something that they were not able to do at all before, but they were trying to. And then you explain why you do it better than someone else. But again, at the core of it is your customer. So in that first part of the formula where you say the customer, the type of the customer and what they're doing, you're basically specifying what circle they live in, call it the neighborhood, right? So that is your specific SOM. That's the smallest circle. The SAM is the circle that you will grow into once you sold to that initial market. That's what you promised in your value proposition, right? For that customer who really needs your product. But then there are other customers who are not desperately needing your product, but they still need it. That's your SAM. That's what you're going to grow into. And finally, TAM is just everyone who could potentially use your product. They may never use it, but they potentially could use it. And that's how we like to think about it. So again, the acronyms are total addressable market, TAM. That's everyone who could use your product. SAM is serviceable addressable market. Those are really people who should use your product, and you know that they should, and you have good reasons to know because you already did the interview and you know they would want to buy it. And then SOM is just serviceable, obtainable market. This is the group that is most desperate, and they will be in the best fit for you. So they're easier to sell to, and that's what you're going after. And that's really what you're selling your investor on. When you see those circles, and we as investors, we look at those circles, we're really not looking much at TAM. So if I go back up here, TAM is just the entire ocean. You will never have the monopoly. We just need to know, it's almost check the box, right? Is the market big enough? if you're going, if you're developing a product for, let's say a dog breed, you'll say you're trying to get a diagnostic test, but it only can work for, poodles. The market is just not big enough. And if you can't grow out of that market into bigger, other breeds, you're dead in the water. So that's kind of just the check mark. Okay, are you in, big enough market? SAM is more important to us as investors because SAM really tells me how much you can grow. So the circles that I was promising you that you were looking at are those circles, TAM, SAM, SOM circles. Again, TAM is your total addressable market. So I was on this slide. I was telling you about the total addressable. That's the could. SAM is serviceable, addressable, should. SOM is serviceable, obtainable. They would buy your product. Okay. So if you were to break down TAM, this is the overall revenue opportunity that is available to a product or service that you're offering if 100% of the market share was achieved, right? It's never possible, but it's everyone who could potentially buy your product and service. A lot of times when you calculate it, you would just go for the industry numbers, right? So it's possible to do a shortcut. You're not really calculating your own revenue. You're just throwing in the industry number. Let's say the market for diabetes is 2 billion, right? I'm making it up. That's your number. You throw it, and that's just the market that you get from the industry reports. That's just to let investors know the market is big. Then you need to narrow it down. I like to think about it is if you're living in all the oceans, like you're narrowing it down to the Pacific Ocean, that's your serviceable addressable market. And that's revenue from the customer segment that is the best fit for your product. Again, here you cannot really get away with industry numbers. So it's not just market for, a slice of TAM. You have to be very specific. So if it's diabetes market, well, what kind of a diabetic are you targeting? What is their demographic? What is that segment look like? You really don't want to promise to boil the ocean. They should really buy because they, either based on their condition, be it severe or light, or you in the preventive space. So you're trying to prevent them. So you're obviously not chasing diabetics who are too far along. You need to focus on customer segment. You cannot get away with the industry number. So when you narrow down your SAM, think of it as, okay, now, you've narrowed down the entire, ocean to the Pacific Ocean. Now you're going for the islands. Where's your beachhead? So in your customer segment, what is your serviceable, obtainable market? So that is the revenue from the beachhead customer segment. Again, we're in the segment. It's your niche. It's everyone who would buy your product. And what you're doing is you are, let's say you're early, then maybe it's 5 years after the FDA approval. Make your stand. And that's where it's really art and science combined. And you need to articulate what you mean by your SOM, by the numbers. Again, that's not just the percentage of SOM or percentage of TAM. Investors absolutely with a passion hate percentages. They don't care how big the market is, and maybe you only need to get 1% of it to get to millions in revenue. That's not going to cut it. That's not how you will convince them. You just cannot use the percentages. You have to be on the segment level. You have to be on the revenue level. So this is your beachhead. That's how much it's worth. And it's very specific. That's why I like to think about the island, is because it's not a percentage of the Pacific Ocean, right? It's something very, very tangible, and you have to be very concrete when you talk about it. So the way you calculate TAM, SAM, SOM is either top down or bottom up. Now the top down, yes, we see it, and that's basically just the industry numbers, and then you try to say, well, this is how much is spent on this condition, for example, currently. You're not trying to calculate your specific revenue. That's really the top down. It's not preferable, but sometimes that's what we see, and it's the best substitute. The best one is obviously the bottom up. That's your revenue based on the number of customers that you think you will get in a very, very specific segment. And again, the timeline. You will get disagreement on what it actually means, because in some cases you will be told, well, this is just how big is your tiny, percent of, that market, that segment. Let's say people who are diabetics that are in that stage of the disease. And then you can almost take 100% of those people, and that is your number. Others will tell you, no, you have to be more specific. You have to look at the resources that you have as a startup and convince me that what you're telling me is actually realistic based on the resources that you will have. There is no right or wrong answer. You just have to be specific on how you calculated it, because there's just no agreement on what we mean, unfortunately, as investors, when we talk about TAM, SAM, SOM. And there are definitely challenges in defining those, and that may drive you towards calculating it one way or another. But the challenge is really defining your industry or customer segment. And a lot of it has to do with customer discovery. Maybe you're still in that pivoting stage where you don't know exactly what segment will resonate the most. So you're trying to use more segments, and you're kind of putting them in the bucket. And again, the data availability is big, because sometimes you just don't have the numbers, so you have to use some substitutes. But the most common mistakes are definitely overstating industry size or customer segment, and not sounding realistic. Global versus national size. A lot of times there is that sort of shortcut where you're doing TAM as a global number, right? Because you have the industry number for the global market. So you put that down as a TAM. You put SAM as national, let's say US market. And then SOM, let's say you're really sloppy and you just do a percentage of the US market. Or maybe you go local, maybe you go geography, and you say you will get California. But the problem is, if your product is really not easily sold on the global scale, there is no reason to put global as the number, beyond just that you don't have the data, and that's what you stuck with it, and you just have to do it. Because what would happen is, in the go-to-market strategy, all of a sudden the question is, well, do you have IP globally? No. Do you have ways to get in the European market? Well, not really. And then it starts breaking down, and it's breaking down like crazy, and you're hurting yourself. So make sure that when you make a stance, right, what you define as your TAM, SAM, and ultimately SOM, that it goes hand in hand with your go-to-market strategy, and realistically, are you able to grab that share? Because it's meaningless. Again, global is meaningless if you're very local. Let's say you can't ship. Let's say you're doing radioactive medical, radioactive isotopes for medical application. Well, can you ship there? Right? And based on how stable your isotope is, can you actually ship it to the place you promised to ship to? Or is anyone in that part of the country really able to purchase it? They don't have, do they have funds? Again, there is no consensus on how you built your TAM, SAM, SOM. So it is up to you. You just have to make a good story, and it has to be a realistic story. So the top-down approach. So if you remember our first session, we practiced on that imaginary self-cleaning diaper, and we said that we are selling that self-cleaning diaper to mothers who are busy, they're working moms. So if we were to use purely top-down approach, this is how it would look. I would go for global diaper sales. Right, just purely, number of units sold, or amount of money being spent globally. I'm then going to go to US diaper sales. Again, I'm just pulling the numbers, industry numbers, and that becomes my SAM. And then I'm going for California diaper sales. Again, I'm using those numbers. So that's very much of a top-down approach. And in this case, you're sort of implying that you're going to get 100 in each circle, you're getting 100%. If you're going bottom up, and again, remember our value prop is for working moms who are taking care of their toddlers. We offer those self-cleaning diapers, right? So now your TAM would be all moms with toddlers times price per unit plus units required. So in TAM, it's everyone who could use, right? So you don't care that for you, it's the working mom. That's the target because that's your segment, right? Your TAM is just all moms, and that's fair game. That's the industry. When you go down to SAM, that's really who should be using your product. That's the perfect fit, let's say, right? And that's the working mom. Now, again, we're not arguing whether it's a perfect fit or not. Working mom, maybe it's, it's a different type of mom. Maybe it's a lazy mom. Doesn't matter. But once you stated your value prop, it has to match this. So now I'm saying SAM, what I'm claiming is my perfect customer segment has to be that SAM. It's the working mom. And then I'm multiplying it by price per unit plus number of units. And then finally, SOM now becomes very easy. I'm doing California numbers, so it's all working moms, but they're just in California. And I'm multiplying again price per unit times units. So what you notice here is I'm doing 100% of each circle, right? In this case, in this scenario, I'm not saying me as a startup will never get monopoly in California. But this is my wish list. This is what potentially I could grab. Again, someone would push against that model and say, you have to do it differently. You actually have to take into account how many moms, working moms in California, you were able to reach. And in this case, a percentage of California moms, right? Because you're B2C, I'm sorry. So you could use percentage in this case, but it's very specific. You're going in California, you're targeting working moms. And now you're only promising what you will grab with your startup money and resources. But again, it's completely legitimate to do it this way, where you're basically claiming 100% of California market. You just have to be very clear in your pitch and articulate that. Now, your financial projections will show your 5-year EBITDA, right? So that would give me a sense of how much of that 100% of California are you actually capturing realistically. So let me stop here. Let me go around. Let me ask you for someone to give me their customer segment, their SOM. So that is the the smallest circle, that's your beachhead. So tell me your value prop first, and we practiced the the value proposition before in the previous module. I only got one email from you, so only one startup gave me their value prop. So I don't know who worked on it, who hasn't. So I'm just gonna assume that you all did your homework and you wrote up your value prop, or you knew it before, so you didn't have to work on it. So please give me your value prop and then tell me about your SOM. Okay, I will ask for volunteers first, so feel free to just unmute yourself. All right, volunteers going once, twice, no takers. Can I ask John Wainwright? You're first up on my screen, so. Okay, is John there? John might not be there. Okay, let me go to David Francis. All right, everyone's hoping that they will just have to do it only when they have to go for the competition, right? No one wants to practice. Gan Sasaki.
Hi, can you hear me?
Yes.
Listen,
Thank you.
I work for this company that provides asset management, and I'm just joining this webinar to see what some of my clients have to go through in order to start the company.
Oh, great.
So yeah, I'm not here to actually present my ideas for a new business. I'm just here to learn what my customers go through when they start a new business.
Great. Do you have a good example of one of your customers that you might guess what what their value prop is in their initial segment?
Well, my understanding is that the people who are attending this webinar are life science people. Is that a wrong assumption? I was beginning to think that that was a wrong assumption.
Yes, that's my assumption as well.
Okay, good. So yes, my customers are life science companies, pharmaceutical companies who produce drugs, and the service that we provide is to manage the assets that they have. So centrifuges, incubators, HPLCs, those things. And what we do is we send the account manager to the company, and then help them maintain the equipment, scheduled maintenance, planned maintenance, unplanned maintenance, those things. So
okay, so
that's what we do.
So what is your beachhead? So you obviously can, and I'm assuming you're local. So what is your SOM? What is the
Well, any company with at least 50 people, employees, and any company with the budget, the maintenance budget of at least $1 million is the life science. I shouldn't say any companies, the life science and the biopharmaceutical companies.
Perfect. So again, like you have very specific qualifiers, right? It's not just 1% of life science companies that you're trying to grab. You have very specific 5 employees, 1 million budget. So I would define that as your SAM for everyone's sake. So if I'm, if I want to use that as an example, SAM would be those life science companies, 5 employees, 1 million budget.
Actually, we're talking about 50 employees.
Oh, I'm sorry, 50.
Yeah.
Okay, sorry, 50 employees.
Okay.
Now TAM would be just all life science companies, right? That would be my, that's the number I would put up there. Okay. Now my SOM would be something different. So is it based on region, the location, or do you narrow it down even more tightly for your SOM?
Well, as a company, we are global. We just started, servicing globally, but mainly the United States. And my area is on the western region of the United States.
Okay, so that would be your SOM. Okay, that's nice and easy. So so that would be easy to construct the TAM SIM SOM in your case. So let me thanks so much, Gan. I really appreciate it. And again, it doesn't matter that you don't have a startup. Everyone still functions on the following the same rules. So let me ask someone else. Let me ask again. Anyone wants to volunteer? Nope. Okay. Hiba Fakro, can I ask you if you're able to?
Yes. So we're also global, but I'm thinking more about it right now. All hospitals, and then that's for TAM, and specifically to doctors with the special metabolic doctors. That's a SAM. And for some, it's the child that is sick at home, in home. So.
Okay. And what is your value proposition? How do you define your value proposition?
So we're still, but we're more tuning to more emotional, because we're still, as I told you before, it's a couple things. We're still thinking it's more emotional right now, but it's also time saving. So we're still working on to see which is the most helping for parents and the caregivers. So we're talking to more customers and more people that would be interested to see.
So for specific segment, you are offering a metabolic test.
Okay. It's a device. It's kind of an in-home device to measure blood for a special condition for PKU children.
Okay. So in that case, so you're saying you're going after all the hospitals. So are you going for the test? You're saying it's administered at home, right? So
as you said here, like all moms, like yeah, it can be used at all hospitals. It can be used more specifically in metabolic areas, you know, and then so some definitely the children with PKU will buy that device in their home, like to keep it at home. So that's how I'm breaking it down.
Okay. And have you made your calculations of the size of the SOM?
Yeah, we already made the calculations.
Okay. And how did you choose to make that calculation? Are you doing the bottom up? How much you will, you know, your profit?
Yeah, bottom up.
Okay. And what are you multiplying it by? So are you taking so the price of your test multiplied by what?
So it's like
But I guess when I'm looking
so
like
it's like, you know how you pinch yourself to take a sugar test? It's so it's like something that they need to buy times how much they need, like monthly times how per child, you know, like
okay,
how much they might need.
Got it. So that's very close to actually the diaper example. But my question is, how are you getting the number of those, you know, children? Because you're multiplying it by the number of children that would need that, right? So how did you get them to the number to multiply your product price times the number of units needed?
So market research report.
So is it the number of patients? Where?
The number of patients.
Okay, in the US?
So
or where?
Yes, and we're gonna start in US. Yes, it's gonna be in US.
So in your SOM, are you taking a slice of that, or are you multiplying all the? So basically, you seem to be going by the condition. So are you multiplying it by all the children in the US with that condition, or are you narrowing that, or are you manipulating that?
No,
number?
so our SAM is the US. But the SOM is more like Santa Ana and like LA right now, children.
Okay. That's what I was asking.
So SAM is our, yeah. So we are located in Irvine, so we are close to Santa Ana Shock Hospital and LA, so we're working with them.
So is that market, if you're defining SOM, you know, my concern might be that it might be a little too narrow for the presentation. So for the definition of SOM, are you being a little too narrow, meaning Santa Ana, you know, Irvine?
So right now we're still working on our device, and when we can, like when the device is like in the first hospital, then we expand, you know. But yeah, we started.
I get it. So I think you might be making one mistake that some startups do, is you are thinking of a beachhead as your almost like first and second customer. I think you need to think of your beachhead as a type of a customer that wants it the most, but maybe it's a bigger area. So your SOM might be, you know, SoCal. Now, you're definitely not going to go after SoCal immediately, right? You still start with, you know, your mini beachhead, you know, your first landing is those two hospitals, for example. But that's not SOM. You don't want SOM to be that small. SOM is still a big market that you're going to focus on it, but it should be big enough. So let me ask you, what was the number in dollars of your SOM, the way you did it?
So for 3 years, 10 million.
10 million? Okay. That's based on how many hospitals?
People in the area, not hospitals, just people in the area.
Okay. It's not a small number, but it probably, I would argue that that's more a number for your financial statement, financial projections. your SOM should be a bigger area. Because I'm looking normally into 5 years, right? So in 5 years, are you going to stay in that market and not move further out into the SAM?
Yeah, as I told you, it's like it's a global issue, and as when we like have more idea and have more like established nearby, then we expand as we grow, as we expand, as we grow, as we expand. So that's, but I understand what you just said, and yes, I have to think more about my numbers, think about more my SOM. So I definitely agree with you, and I'll work on it more. Yeah.
And again, there is not, no one will question if you created the slide this way, and as long as you explained it that way, it's not critical, right? Like an investor who's sitting and having a conversation with you, if they see a bigger SAM and they're excited about it, they will understand that you just underestimated your SOM.
Yeah,
However,
I just told you what I really have connection with. Like I really met those people and have connection with, than just like just putting a lot of numbers that we might get. So so
and
right now it's what we have. Yeah.
Yeah, and it's very good. And it's just that I think what sometimes happens is, and we'll move to the go-to-market strategy, right after this. But there is sometimes a disconnect between what is SOM, what is that segment, and how much it can bring you, versus your go-to-market strategy, which is spread over a number of years and is very, very specific and ends up in your financial projections. So again, it's not a mistake. You just have to be very direct when you pitch. You can't just say our SOM is 10 million, because what investors might interpret that is that you're saying that the initial segment is just 10 million. And it's going to, and everyone thinks that you will spend a lot of time in that segment. SOM, it takes a long time to conquer. And if it has that limitation of 10 million, as an investor, I may look at it and say, that's not big enough, because I don't think you're going to grab all of it. So if 100% of your SOM is 10 million, and you only grab in a percentage of it, which is what will happen, right? I'm looking maybe at 3 million. Now I'm thinking, oh, shoot, that's probably not very attractive.
Yeah.
So that's the danger. Now, there's obviously times when we see SOMs that are, oh, our SOM is 1 billion. Well, that doesn't help either, because that's a little too much. For the most part, I mean, there are cases where, okay, you can argue that actually that beachhead, that segment could be 1 billion, but it's very rare. Okay, so let's kind of move forward to the go-to-market and the competition. And that's where you are explaining how you will get to that SOM. And that's why it's critical that you define it very specifically, because not only you need to know what that market is, but also, is it possible to get to it with the resources that you have in a way that you explain in your go-to-market strategy? So again, are you, is it, in simplistic terms, you get in your boat? Are you buying a boat to get there? Are you leasing your boat to get there? Is there a landing in your market? Can you, when you arrive, is everyone there to listen to your proposition, or do you have to, go from village to village? So let's say your island is big enough, but go-to-market strategy is critical, because if they are all spread out and your strategy is simply, go one village at a time, that's a long haul, right? That's not it. So that's what ultimately, that's what go-to-market means. And we see a lot of startups making a mistake in the go-to-market strategy, being really, really vague. They're basically explaining commercialization. They say we will, we'll get an FDA approval, then we'll have clinical studies, and then they kind of end by saying, and then we'll start commercialization. that's not what go-to-market means for investors when we analyze those pitches and the go-to-market strategies. For us, it means something very, very concrete. It means how will you actually get to that, like literally, are you getting there on the boat? Are you getting there in the canoe? How will you communicate? How will you reach that customer? The big question is, are you B2B or B2C? And a lot of times it doesn't get articulated clearly. And for example, last case, right? It's a test for kids. Is it a B2B strategy or B2C? Now, B2B would be I'm going through hospitals and I'm really reaching physicians. And not one by one, I'm reaching them as a business, right? So I'm reaching a practice. Or am I going B2C? Am I trying to go to moms? So Hiba, can you actually tell us what is your strategy in reaching out those parents? Is it B2B or B2C? What have you decided on?
It's both.
Both.
So
okay.
It's more like a cloud that will connect the in-home device right away with the doctor.
Okay, that does not tell me how you're selling. That tells me how the product operates. But as far as selling it,
so both doctors will need it in the clinics and in the hospitals, and it's good to have daily in their home.
Okay, if you are selling only to clinicians, right, and they're the ones paying you, and then it ends up at home, that would still not be considered B2C. So, and that might make, again, you may make a mistake in the pitch saying you're B2B and B2C and raise a lot of red flags. B2B is very clearly you are selling to the professional. You're selling to a business, be it a hospital or practice, and then it ends up with a mom. It ends up at home, but it ends up through that physician. You do not directly go to that mom or try to sell to her. Now, maybe that's not the case. Maybe you're actually thinking you need to go and sell it to mom, and then she somehow she buys it, and then the physician helps her, use it. Right? That would be B2C. Mm-hmm. So can you clarify a little bit which case you
I think in the beginning it's gonna be, as you said, B2B, and as more as we by time it's gonna be like easy for them to reach, like pharmacies and things like that. But I think at the beginning of our way it's gonna be B2B.
Okay, so if I have a red flag as an investor, my red flag is that at the beginning it's B2B, but what I'm hearing is at the end it's flipping to B2C. But I'm not clear if at some point physicians stop writing you checks and parents start writing you checks. Because I don't think that's the case, but that's what you, in a way, communicating when you say initially you're B2B, eventually you're B2C.
Yeah. Yes,
I know
it's so much to think about, especially when you're in the beginning of your like we're still at the beginning, so we're still testing our device, and so it's something that helps definitely the caregivers, and it should be an in-home device, but also like something new. So definitely when doctor help you out, it's peaceful for the parents, I think, or like it gives them a smooth. So at the beginning it should be directly with the doctor.
Okay, so the way you would determine are you B2B or B2C is basically who will write you a check and whom are you going after with your communications. right? Because if it's something that just has to be blessed by physicians, liked by them if they happen to see it. So if I'm a mom and I purchase a product, and then I happen to mention it to my pediatrician and say, hey, I'm using this cool gadget. So let's use those socks as example. I think they were called owl socks, right? They they would monitor. They had sensors in them, and they were meant to be put on the infant, and then monitors their vitals. Now, this is something that moms were buying, right? And then they might mention it to pediatrician and say, oh, hey, I have the sock on my kid with sensors, and it measures their vitals, and can I show it to you? That would be the case of B2C. Moms are definitely paying. They are your customer. And if you were to do a customer discovery, you would have to do a customer discovery with a mom who's buying those socks.
So then definitely it's B2B because
okay.
It's something like it's a blood, so it needs monitor, it needs doctor. It's not gonna be something you just buy and wear and use, like, yeah. So definitely it's B2B, even though the parents will want it.
Perfect.
But yeah.
Perfect. So in this case, you never want to say initially we are B2B. You just want to see we say we are B2B.
Okay.
You always want to close that door. Now, does anyone have an example in with their own startup where they think they are both B2B, which could be, and it's not a wrong answer. But does anyone have truly B2B and B2C? Anyone? No one? Okay, I will give you an example then of a company that I'll try to be discreet as far because confidentiality. So so it's vague. They were selling initially, just like what we heard. Initially, the phase one was B2C. That is because they did not have an FDA approval, and they were trying to test the market. And again, it was directed at moms. It has to do with feeding the baby. That's as much as I'm going to say. And they were selling that solution to the moms on Amazon, and they were getting initial sales. That was never their goal. They couldn't really get traction. Well, I shouldn't say it wasn't their goal. At the beginning, they didn't know if that would be their goal. They wanted to do customer discovery. They wanted to make sure that moms saw value in this. And they've proven, because they had sales, that moms did see value. However, the sales were very small. They had to spend a lot of money, and they would cover, they would actually get some profit, but they could not break through that kind of ceiling, right? It was too expensive, and moms were not paying enough. They would have had to raise a lot of money to throw at advertising, and it just was not realistic. So they switched, which was originally they always wanted to be in the NICU and sell to the NICU, right? But they wanted to go to moms to prove that moms would want that. So they've done that. Now they couldn't go into the NICU yet because it was not FDA approved. So they interviewed NICU staff. They validated that it would have been desirable, but they still could not go into the NICU because of FDA, and they were raising money. So the dilemma was, again, to say, we're kind of B2B, B2C, and investors hate that. So the solution was to present it, to frame it in a different way, to say that at the phase one. So that's where, like, it sounds similar, but it's very different, because in this case, that was really phase one, and phase two were very distinct. Phase one, they called it pre-FDA. And they were not going to stop direct sales to moms. So there were still sales going B2C. So in the phase one, they were B2C. They kept on selling to moms, but not spending a lot of money on it, right? They were not, remember, they were raising money. And what investors did not want them to do is take that money, pour it into more marketing to the moms, and get sales slightly higher, because those sales would never have scaled. right? It's just a losing game. So, but they didn't want to stop those sales either. They wanted to, keep it steady, keep it low burn, but it was still generating some revenue. So they were okay with that. They labeled it phase 1 pre-FDA, and then they said post-FDA is clear B2B. We're switching completely to NICUs. We know that the demand is there. We interviewed NICUs. We know they will buy it. And at that point, all the money that investors give them will go to that strategy. It was clear B2B. Now, did they put SOM as B2C? They actually did not. So that's where it becomes tricky. So if we look back to SOM, right? Theoretically, Hiba, when you were saying your initial SOM was small, right? It was just a specific geographical area, for example. So same thing for them. The dilemma was, do they just say that initially it's just B2C sales to moms? And initially they actually did do that, but then they revised it to SOM being still NICUs. And what they did with mom-to-mom sales was, like I said, it was a go-to-market strategy, and it was phase 1. So it never showed up on SOM. SOM was always NICUs, and NICUs were calculated at what NICUs they would be able to reach in the first, 5 years post FDA. That was the market. So be very careful, be thoughtful about it, because there is no right or wrong answer sometimes. One way to go about it would have been to completely discard B2C sales and essentially never even mention them in your investor pitch, right? It may come out in due diligence that, hey, yes, we were experimenting and we were doing some B2C sales, but make it into pure B2B pitch and stick to your guns and say B2C was experimenting, trying to figure out if moms would even want that. That was just our little test. It's all up to you how you frame it. What you have to do is you have to convince an investor that you were very smart how you went about it. And that was clearly a strategy as opposed to just shots in the dark. And you were going to stop those sales the moment you got real money and you could scale and you had an FDA approval. So again, let me ask if someone else has an example where they are going, let's say they're going B2B or B2C. Can you tell me what your SOM is, and then what is the go-to-market strategy as far as the segment? Can I ask maybe Mahesh?
So I can discuss mine.
Oh, hi, John.
Hi. So my device treats ischemic stroke patients, and we're working on FDA approval. Mm-hmm. And so, the total market would be all ischemic stroke patients. It's a medical device, so the smaller market is those being treated for mechanical thrombectomy, and then there's a smaller portion for distal strokes that our product fits very nicely in. So that would be the market we would go after in the 5-year time frame.
Mm-hmm. And how big is the distal strokes? How big is that?
It's about 40,000 strokes a year being treated, just in the US. We would also have Europe eventually.
Okay, and if you multiply it by the revenue that you will be getting, what would be the number?
Generally, devices are around $6,000 a piece currently.
Okay. So let's if you what is your go-to-market strategy? How will you get to those patients in those particularly 40K? Do you guys see my screen? Sorry, my Zoom is acting up.
Yes.
Okay. So the 40,000 strokes, right? how do you get to the patients with them? What is your now sort of the go-to-market strategy? I'm assuming it's obviously B2B. You can't go B2C. That's not even an issue. So for
Right.
you, the question is, well, let me actually advance a little bit further. The best channels to reach your customer segment, that's where you're at. So how would you reach those patients? Would it be based on the type of a hospital, or how will you tap into that segment?
Yeah, through a sales force. So, building, it would be neurointerventionists would be the physician population, and there's about 1,200 across the US.
Okay, so that's not a big number, right? So that's actually realistic to reach with just the sales force. And I'm assuming you're not breaking it down by a type of a hospital. You're basically identifying those clinicians, essentially named by name.
Yes, but we would focus on the large volume hospitals first. So
Okay.
there's about 200 hospitals that are large volume. So that way we can target that with a small sales force.
So I would say that again, the 1,200 total physicians would be your SOM, right? That's where you're going after. But the go-to-market strategy, that initial push, would be targeting those 200 hospitals that have the highest volume. So is that correct? That's how you think about
Yes.
it?
Yep.
So that's very, very clear. That's where I'm trying to kind of break down that misunderstanding sometimes, the play between the SOM and then the go-to-market strategy. It's identifying that segment, that initial, and again, in your SOM, I think you define it very easy for investor. The key is really, how do you get to those cases? And in your case, again, it's pretty easy to identify that. I wouldn't have any pushback on that one. So let me just go back. So we have the decision on the go-to-market strategy. Just quickly, the first decision is, again, B2B or B2C. Once you made that decision, you also need to tap into your competition, right? Who's your main competition and how you fit into the competitive landscape. In this case, you're looking into who is sitting in that waiting room along with your sales force people, competing for the same 1 hour or 10-minute interview with the decision maker. And the decision you need to make is, one is, how do you differentiate your value prop, right? When they walk in right after your competition, how do you pitch it? Now, in some cases, there's no competition in the waiting room because the competition is status quo, nothing is happening. But that's what you need to explain to investor very clearly. Are you competing with the silence in the waiting room, or are you competing with someone who's actually sitting right next to your sales guy? And when you do the competition matrix, what you want, and again, status quo is also a competition, but you need to define it in terms of the benefits that you provide and benefits to the customer. So John, how would you define your benefits that you deliver? And again, are you competing with status quo, or are you competing with current solutions? You muted, John. And I know you told me you're on the road, on the move. So if you were no longer able to unmute yourself, actually dropped out. Okay, so again, define what would be the benefit to the customer, not the product feature, but the benefit. Compared to your competition, talk about the status quo, because that is, in a lot of cases, your main competition. You don't want to be the educational sale. And by that, we mean, investors hate educational sales. That means there's nothing that you really even compete with that is currently used. You are so new that you would have to educate the consumer that they actually could use you. And finally, that's what we talked about, the best channels to reach your customer segment. You have to be very specific. And the answers on the slide, but they're also the answers that you have to come up with when you think about your business is, how do you reach them? Do you hire your own direct sales force, or what are your other options? And you don't want to have a laundry list. It has to be specific. So maybe you're contracting with an external sales team, maybe use distributors, which ones? Maybe use strategic partnerships with companies who sell to your customers already, or it could be direct to consumer, right? In this case, that's your strategy.